Good morning, students. Okay, I'm waiting for 2 more minutes so that everybody can join us. அன்யூஷுவலாக எல்லாத்தையும் காலையில் 10 மணிக்கு எந்திக்க வச்சிட்டேனா 55 have come so far. I'm waiting. 67. அவ்வளோதான் வருவாங்களா? இன்னைக்கு half day தான் attendance, half class தான் attendance. Am I audible? Yes. Okay. 71. No data காமிக்குது மறுபடி. ஏன் அப்படி பண்ணுச்சு? ஓகே, ஐம் ஸ்டார்டிங். பார்ப்போம் மிச்சவங்களாம் ஜாயின் பண்ணிக்கிறாங்களா இல்லையா அப்படின்னு பார்ப்போம். 65 viewers, 79. Yeah, numbers fluctuate ஆகுது. Okay, today's topic is thyroid. 1 minute. நீங்க என் முகத்தை பார்க்க வேண்டாம். You're going to look at the PowerPoint. Okay. Today's topic is thyroid gland. Thyroid வந்து ஏற்கனவே if I am not wrong உமாபதி செம்பியன் சார் எண்டோக்ரைன் சிஸ்டம் முடிச்சப்பயே மேக்ஸிமம் உங்களுக்கு சொல்லிட்டாரு. ஸோ இன்னைக்கு வந்து இட்ஸ் கோயிங் டு பி மெகா ரிவிஷன் அண்ட் இப்போ நீங்கள் கொஞ்சம் நெக்கில் இருக்க ஸ்ட்ரக்சர்ஸ் உங்களுக்கு தெரியும் அப்படிங்கிறனால யூல் பி ஏபிள் டு ஓரியன்ட் பெட்டர் அப்படிங்கிறது தான் இந்த தைராய்டு கிளாஸோட ஐடியா. ஸோ லெட்ஸ் சி. So what are the contents that we are going to see are, we are going to look at the introduction, the gross features, the relations, blood supply, nerve supply and applied anatomy. Thyroid gland is a very, very, very frequently asked question, especially even if it is not asked in the theory question, it will appear at least in your discussion. So you have to know thyroid, there is no choice. And being Indian medical graduate, you need to know thyroid because we are prone for hypothyroidism, Indian public as well. Okay. Now coming to introduction and location. Can anyone tell me the location of thyroid gland, because this has already been dealt in the midline structures of the neck? சொல்ல முடியுமா? The location of thyroid gland in the vertebral level. Anybody? Excellent. C5 to C7 and T1. Okay, very good. Okay, so everybody is giving the answer right. You are right. It is located at the vertebral level from C5 to T1. But அது எப்படி சொல்றோம்னா, that is mainly of the lobes. Okay, lobes வச்சு தான் நம்ம சொல்றோம். So lobesல it is located, as you said, from the cervical fifth vertebra to the T1 thoracic first vertebra. It is located anterior to the trachea and the larynx. So why is it called as thyroid? Thyroid is called because actually இது வந்து thyroid cartilage வச்சு தான் அந்த name. Thyroid cartilage is called so because it looks like a shield. It looks like a Greek shield. ஸோ ஷீல்டு மாதிரி தெரியறனால தான் அது பேர் தைராய்டுன்னு வச்சாங்க. அது மாதிரியே இங்கே கீழே ஒரு பட்டர்ஃப்ளை ஷேப்ட் கிளாண்ட் இருந்தது, அதனால இட் இஸ் கால்ட் அஸ் தைராய்ட் கிளாண்ட். ஓகே, இப்போ வாட் இஸ் த பெக்யூலியாரிட்டி ஆஃப் தைராய்ட்? We know it is an endocrine gland, so it is a ductless gland. It secretes hormones, T3, T4, all that stuff you know. So what is the peculiarity of this thyroid gland or the endocrine gland? Endocrine gland, as we can easily assume, it is going to be rich in blood supply, unlike any gland that secretes enzymes, because this is the main carrier. Blood is the main carrier, so it is going to pour its secretions into the blood, and hence the blood should be available in lot, and hence the thyroid gland is rich in blood supply. One point. Second point, it is the only endocrine gland which can store its secretions. Unlike any other gland, any other endocrine gland in the body, this is the only endocrine gland which can store. Okay, yes. The third point, this is the most superficially located endocrine gland. All the other endocrine glands are deeply placed, well secured, but this is the most superficially placed endocrine gland. And this is the only gland that looks for its raw materials from the food we eat, from the environment. Unlike any other endocrine gland in our body where they secrete their own endocrine hormones, this gland needs iodine. So iodine has to be there in your food, then only it can secrete T3 and T4. So these are the peculiarities of thyroid gland. இப்போ location wise we have told about the vertebral level. When it comes to the tracheal rings, okay, tracheal rings, the apex goes as far as the larynx. As you can see here, the apex goes as far as the larynx. The lower border goes as far as the T4, that is the tracheal fourth and fifth ring. So that is the extent of the thyroid gland. It is placed in the midline structure. This we all know. Before we go into the details of the thyroid gland and its parts, I would like to talk about this. When we talk about the neck, there are a group of viscera in the neck and they are placed in a particular layer. Okay, so there is an endocrine layer, as you can see here, the pink structure. There is a respiratory layer, that is the larynx and the trachea, and there is an alimentary canal layer, that is the pharynx and the esophagus. So these are the viscera present in the neck apart from the neurovascular bundle, which ellame they are musculoskeletal system, isn't it? So the viscera that is present in the neck, when we talk about the viscera present in the thorax, we talk about the heart and the lungs apart from the neurovascular bundle. Abdomen, there are so many viscera, but here the viscera present are can be divided into three layers, that is the endocrine layer, the respiratory layer and the alimentary layer. The endocrine layer will be the thyroid and the parathyroid gland, that is most anteriorly placed. The next layer will be the respiratory layer, which contains the larynx that continues as the trachea, and then we have the alimentary layer, the pharynx and the esophagus. The pharynx continues as the esophagus. Now, coming to the capsules, okay. So before I go into the discussion of the parts of the thyroid gland, I want to tell you about this. There is a capsule. That is not a capsule. There are two capsules here. One a false capsule and one a true capsule. I would like you to remember the capsular arrangement of the prostate. Can anyone tell me what are the layers that you can see in the prostate? தம்பி ஹேங் ஆயிடுச்சு. The capsular arrangement of, excellent, prostate. The capsular arrangement of prostate was the question. Okay. YouTube is not receiving enough video to maintain smooth streaming. என்ன ஆச்சு இன்னைக்கு? ஏன் நான் ஒன்றும் பண்ணல. Sorry. Okay. Yes, as you said, the capsule of prostate are a true and a false. So here also there are two capsules. There is a false capsule and there is a true capsule. The true capsule, as for any other gland, is going to be the condensation of the parenchyma, so or the fibrous tissue of the gland. So true capsule, that we can understand. The false capsule here is because of which layer of deep cervical fascia? False capsule of the thyroid gland is a part of, excellent, pretracheal fascia. Super students, பக்காவா இருக்கீங்க. அது ஏன் அப்புறம் SDL ல மட்டும் இந்த அளவுக்கு வரல? Yes. The false capsule of the thyroid gland is because of the extension of pretracheal fascia. As you can see here, pretracheal fascia, if you remember, superiorly it is attached to the hyoid bone. When it reaches the apex of the thyroid gland, it splits into two to enclose the thyroid gland, and then unifies at its base and continues with the fibrous pericardium in the thorax. So that is the superior to inferior attachment of the pretracheal fascia, and that forms the false capsule of the thyroid gland. Now, what is its importance? Why should we know this? The blood supply, that is the arteries and the veins, are placed interior to the false capsule, unlike the prostate where it is placed in between the true, that it is sandwiched between the true capsule and the false capsule. நான் சொல்ல வர்றது என்னன்னா, இங்க blood vessels are placed inside the true capsule, on the gland inside the true capsule. So even if you need to remove the gland, you have to remove it along with the true capsule. Unlike prostateல என்ன பண்ணணும்னா, true capsuleக்கும் false capsuleக்கும் நடுவுல venous plexus இருக்கிறனால true capsule retain பண்ணிட்டு false, only the parenchyma of the gland is removed. That always leads to recurrence of prostate development. இங்க அப்படி கிடையாது. ட்ரூ கேப்சியூலோட சேர்த்து தான் நம்ம ரிமூவ் பண்ணணும். அப்போ தான் ப்ளீடிங்கை ஸ்டாப் பண்ண முடியும். ஸோ திஸ் இஸ் தி அப்ளைட் இம்பார்ட்டன்ஸ் ஆஃப் கேப்சியூல். இது 2 மார்க்ஸில் வெரி 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 ஃப்ரீக்வெண்ட்லி ஆஸ்க் கொஸ்டின். ஆல்சோ எம்சிக்யூவில் கேட்பாங்க. Okay. Now, the pretracheal fascia here gives an attachment called as ligament of Berry. Okay, this ligament of Berry is a derivative of the pretracheal fascia or the false capsule of the thyroid gland. This ligament of Berry attaches the thyroid gland to the tracheal rings. This is the main reason why thyroid moves with deglutition. Okay, so remember this is the only gland. When there is a swelling in the neck, the first thing the doctor asks is to swallow your saliva, deglutate. Okay, so when you swallow your saliva, if the swelling moves, then it is thyroid gland. The thyroid gland moves with deglutition because of this attachment, that is the ligament of Berry, which is a derivative of the pretracheal fascia to the tracheal rings. Okay, so this is a very very frequently asked question during discussion. This also you should know. So that brings us to the end of the discussion of capsules of thyroid gland. Any doubts, please tell me. I will try to explain. இல்லப்பா, டவுட்ஸ் இல்லைன்னா அட்லீஸ்ட் நோ டவுட்ஸ்னாலும் சொல்லுங்கப்பா. நான் இன்னும் பிளட் சப்ளை பேசவே இல்லை. நான் சொன்னது, ஓகே, ஐ எம் ரிப்பீட்டிங் இட். ஓகே, false capsule, true capsule உங்களுக்கு புரிஞ்சிருச்சு. False capsule is a derivative of the pretracheal fascia. True capsule is the derivative of condensation of the fibrous material of the thyroid gland itself. இது உங்களுக்கு புரிஞ்சிருச்சு. இப்போ venous plexus இங்க நீங்க பாத்தீங்கன்னா, venous plexus is placed interior to the true capsule. Okay, so venous plexus is placed outside the thyroid gland, interior to the true capsule. False capsule வெளியில இருக்கு. So when you need to remove the thyroid gland, you need to remove only the gland along with the true capsule. இதோட ஆப்போசிட் நம்ம ப்ராஸ்டேட்ல சொன்னேன். ப்ராஸ்டேட்ல எப்படி இருக்குன்னா the venous plexus, இப்போ இங்க மார்க் பண்ணிருக்க இந்த venous plexus will be sandwiched between the true capsule and the false capsule. இந்த இடத்துல இருக்கும். ஸோ இங்கே இருக்கும்போது அங்கே ப்ராஸ்டேட்டில் என்ன பண்ணுவோன்னா ஒன்லி த ப்ராஸ்டேட்டோட பேரன்கைமாவை சுரண்டி கியூரட்டாச் பண்ணி வெளியில் எடுத்துருவாங்க. த ட்ரூ கேப்சியூல் அண்ட் த ஃபால்ஸ் கேப்சியூல் அலாங் வித் த வீனஸ் பிளெக்ஸஸ் இஸ் ரீடைன்ட் இன்சைட் த பாடி. So that leads to prostate development in future, recurrence, திரும்பி prostate development வரலாம். பட் இங்க thyroid gland நம்ம ரிமூவ் பண்ணும்போது இன்கேஸ் இப்போ நீங்க அங்க பண்ண மாதிரி இந்த ட்ரூ கேப்சியூலை விட்டுட்டோம் அப்படின்னா வெறுமன thyroid gland மட்டும் கியூரட்டாச் பண்ணும்போது இந்த வீனஸ் பிளெக்ஸஸ் இட் கெட்ஸ் இன்ஜியர் ஆகும்போது ப்ளீடிங் வில் பி மோர் அண்ட் தட் லீட்ஸ் டு டேஞ்சர். ஓகே, ஹெமராஜ். ஸோ அதுக்காக நம்ம இங்கே ஃபால்ஸ் ட்ரூ கேப்சியூலோட சேர்த்து கிளாண்டை ரிமூவ் பண்ணணும். இந்த இப்போ ப்ரீட்ரெக்கியல் ஃபேஷியா லிகமெண்ட் ஆஃப் பெரி உங்களுக்கு புரிஞ்சிருச்சுன்னு நினைக்கிறேன் இல்லையா? Other endocrine glands, they do not store secretions. They pour the secretions as and when required. இங்க thyroid glandல மட்டும்தான் அது கொலாய்டா ஸ்டோர் ஆகி உட்காந்துருக்கும் for a longer period of time. So only thyroid stores. The other endocrine glands, they do not store. Shall I go into the next part? No, true capsule and false capsule, obviously pretracheal fascia is separate, isn't it? So there is a line of இங்க பார்க்குறீங்க பாருங்க, the plane of cleavage. So இந்த இடத்துல it will be filled with loose areolar connective tissue and that can be separated. Okay, now that we have understood capsule, I'm going into the next part. இப்போ parts of the thyroid gland, sorry. Okay. இப்போ parts of the thyroid gland, as you can see here, thyroid gland is a butterfly shaped organ. It has an centrally connecting isthmus and two pyramidal lobes on either side. So these pyramidal lobes, they hug the trachea. Okay, so this is the right and the left lobe. On the posterior part of these two lobes, we see the parathyroid glands, 4 in number, 2 above and 2 below. So that is how they are located. இப்போ presenting parts, as you can see here, this is the isthmus. Isthmus is related to the tracheal rings. Okay, tracheal ring 2, 3 and 4. So that is how the isthmus is related. On either side we have the lobes, the lateral lobes. The lateral lobes, they are pyramidal in shape, which means they have an apex, they have a base and 3 borders. Okay, so the and 3 surfaces. So that is how the lobes are discussed. இப்போ coming to the apex first. Okay, apex, as you can see here, it goes above the isthmus. The level of isthmus is at the tracheal ring level 2. The apex goes above this. It goes as far as the oblique line of the thyroid cartilage. இங்க நீங்க பார்க்குறீங்க பார்த்தீங்களா? This is the oblique line of the thyroid cartilage. The apex goes as far as that level. So oblique line of thyroid cartilage வரைக்கும் apex போகும். So apex is related to the upper border of the cricoid cartilage and thyroid cartilage. This thyroid cartilage, cricoid cartilage, they are all parts of the larynx. So apex, as you can see here, it is bound between the cricothyroid muscle and the sternothyroid muscle. Sternothyroid is a inferior hyoid bone muscle. Okay, it is located inferior to the hyoid bone. The neck muscles of the neck, the anterior group of muscles of the neck are divided into 2 categories, one above hyoid bone and one below hyoid bone. So the ones below hyoid bone is this sternothyroid muscle. As you can guess, this goes from the sternum to the oblique line of the thyroid cartilage. So in the apex is bound between these 2 muscles, the cricothyroid muscle and the sternothyroid muscle. Why is this so important? How much ever the thyroid gland might become bigger, it normally physiologically becomes bigger for women during menstruation and pregnancy. Apart from that, whenever the thyroid gland becomes bigger, you should know from physiology, it has a hyperthyroidism, goiter. So on the time the thyroid gland becomes bigger, but the apex cannot go beyond this because of these two structures protecting the apex. That is the cricothyroid muscle and the sternothyroid muscle. It goes as far, the apex goes as far as the oblique line of the thyroid cartilage. So that is important for the apex. It is related to the superior thyroid artery. Okay, it is related to the superior thyroid artery and external laryngeal nerve. In the superior thyroid artery and external laryngeal nerve has a very important applied anatomy. Okay, as you can see here, the superior thyroid artery, this is the superior thyroid artery. First branch of the, it is the first branch of the, can you answer me that question? Superior thyroid artery is the first branch of display. Excellent. It is the first branch of the external carotid artery. I don't know whether you know this. இந்நேரத்துக்கு உங்களுக்கு தெரிஞ்சிருக்கும். There is a mnemonic to remember external carotid artery branches. Can anyone tell me that? Mnemonic for remembrance of external carotid artery branches. I think it is taking time for you to type it. Okay. It is Sister Lucy powder face often attracts medical students, medical staff. For us, it is medical students, and for you, it is medical staff. So that is a mnemonic to remember the branches of the external carotid artery. And first is sister, and that is superior thyroid artery. So here, what you see here, this structure is the superior thyroid artery. It travels along with the external laryngeal nerve. So this is the superior laryngeal nerve. I'm not able to show you. Okay. So this is the nerve, and both of them meet at the apex of the thyroid gland. So when they are actually they travel very close with each other. When they meet, when they come to the apex, the nerve goes behind, whereas the artery goes anteriorly. This is the posterior appearance of the so this is the pharynx here, and these are the pharyngeal muscles. So this is the posterior surface of the thyroid gland. So thyroid gland நம்ம posterior area ல இருந்து பார்த்துட்டு இருக்கோம். நீங்க இங்க பார்க்கலாம், the nerve, the external branch of the superior laryngeal nerve, that is the external laryngeal nerve, இங்க பின்னாடி போயிடுச்சு. So this is going behind. The superior thyroid artery divides into two, anterior branch and posterior branch in the apex. So when you need to remove the thyroid gland, obviously you need to ligate the arteries and the veins, இல்லையா? So to stop the hemorrhage, what you do for the superior thyroid artery, it is as close to the apex because throughout its course, the superior thyroid artery and the external laryngeal nerve, they travel together. So superior thyroid artery is ligated as close to the apex as possible. That is the applied anatomy here. Whereas for the base, the inferior thyroid artery, which is a branch of the subclavian artery. So this is the inferior thyroid artery coming from the subclavian artery, from the thyrocervical trunk, and then we have the inferior thyroid artery coming out of it. The vagus nerve, after winding around the left left brachiocephalic trunk, it winds around and forms the recurrent laryngeal nerve. So recurrent laryngeal nerve, superior external laryngeal nerve, these are all branches of the vagus nerve. So the recurrent laryngeal nerve and the inferior thyroid artery meets at the base of the thyroid gland. They are very closely related to the base of the thyroid gland. So on the contrary to the superior thyroid artery, the inferior thyroid artery needs to be ligated as far away as possible to prevent damage of the recurrent laryngeal nerve. Now, why should we be careful about these two nerves? These two nerves are going to supply the interior of the larynx. So, when they are damaged, the voice is affected. Thyroid gland or a usual problem after thyroidectomy, this patient will complain hoarseness of voice, because if the nerve is damaged, that results in the hoarseness of voice. To avoid that, we ligate the inferior thyroid artery as far as possible and superior thyroid artery as close as possible. Please remember this. These are the applied anatomy that you have to write for thyroid gland. We don't want hyperthyroidism, hypothyroidism. Those are also applied knowledge of thyroid gland, but it is applied physiology. What we expect is applied anatomy, so that is surgical anatomy. And that நான் இப்போ வரைக்கும் 3 சொல்லியிருக்கேன். ஒன்று capsule related சொல்லியிருக்கேன், இன்னொன்று superior thyroid artery near the apex சொல்லியிருக்கேன், இன்னொன்று baseல inferior thyroid artery சொல்லியிருக்கேன். So these are the 3 surgical importance that I want you to remember. Now coming to the other relations, let us discuss the other parts first. We have told about the pyramidal lobe, the isthmus, and etc. There is an anterior border. Okay, please do not look out for the anterior border here. The anterior border is this. This anterior border separates the superolateral surface of the pyramidal lobe to the from the medial surface. So this area here is the medial surface of the pyramidal lobe. So the anterior border, these red color lines that you can see here, which goes from the isthmus to the apex, this is called as the anterior border. Similarly, from the isthmus to the base, so this is these are the anterior borders. They separate the superolateral surface of the thyroid gland from the medial surface of the thyroid gland. Similarly, there is a posterior border which separates the superolateral posterior surface of the thyroid gland from the medial surface of the thyroid gland. I can show you here better. Okay, when you cut across the neck, this is how it appears, and this is the thyroid gland. The purple color structure here is the thyroid gland. So this is the it is cut across the isthmus. So remember, the anterior border cannot be seen in this because the isthmus is here. This here is the superolateral surface, this is the posterior surface, and this is the medial surface of each lobe. It is the isthmus is seen here, so I'm not able to show you the anterior border. If you can remember, when you cut the little bit superior to the isthmus, you will be able to appreciate the anterior border here, which separates the superolateral surface from the medial surface. There is a posterior border which separates the posterior surface from the medial surface. So there are two borders, anterior border and posterior border, three surfaces: superolateral surface, posterior surface, and medial surface. Now the relations of the superolateral surface from outer to inner, it is partially overlapped by the sternocleidomastoid muscle. Then we have the sternohyoid muscle and the omohyoid muscle. Then we have the sternothyroid muscle. The sternohyoid muscle runs from the sternum to the hyoid bone. The sternothyroid muscle runs from the sternum to the thyroid cartilage, the oblique line of the thyroid cartilage. This is the superior belly of the omohyoid muscle that we can see here. So these are the lateral relations or the anterior relations to the superolateral surface of the thyroid gland. Okay, so these are the structures that you need to remember, which are related to the superolateral surface of the thyroid gland. Now coming to the medial relations, remember two, that is the mnemonic here, two. There are two tubes, one is the trachea and the other one is the esophagus. So two tubes, two nerves. One is the recurrent laryngeal nerve and one is the external laryngeal nerve. So two nerves, recurrent and external laryngeal nerves. Two tubes, two nerves and two muscles. Inferior constrictor muscle and cricothyroid muscle. Okay. So this picture shows you the sternohyoid muscle, and this is the sternothyroid muscle. This is the sternothyroid, this is the sternohyoid, and totally overlapped by the sternocleidomastoid muscle. So these are the superolateral relations to the superolateral surface of the thyroid gland. Okay, this is the cricopharyngeus muscle. As you can see here, it is a part of the inferior pharyngeal constrictor. So that will be the muscle related to the medial surface of the thyroid gland. Posteriorly, we have the relations of the posterior surface. We have the carotid sheath along with its contents. So these are the relations of the thyroid gland. There is a superolateral surface, some muscles are related to it. Medial surface, two is the mnemonic here. So two tubes, two nerves and two muscles. The posterior surface is related to the carotid sheath. Any doubts so far? Okay. I'm able to see your no ma'ams. I'm waiting for if there are any other. Can you please repeat why we ligate the artery far and near? I will repeat it again when I talk about the blood supply. Uh, I saw a question. கேப்சியூல் வந்து ரீட்டைன் பண்ணணும் அப்படின்னா அங்கே இருக்கிறதுல இம்பார்ட்டன்ட் ஸ்ட்ரக்சர் தைராய்டு. கேப்சியூல் ஹேஸ் நோ ரோல் தேர். ஸோ கேப்சியூலை ரீட்டைன் பண்ணுற மாதிரி ஒரு சர்ஜரி கண்டுபிடிச்சாங்கன்னாலும் அதனால யூஸ் இருக்குமா அப்படின்னா ஐ டோன்ட் திங்க் ஸோ. இப்போது கேப்சியூல் எப்போ ரீட்டைன் பண்ண ட்ரை பண்ணுவாங்கன்னா உங்களுக்கு இது தெரியுமா தெரியாது, கேட்ராக்ட்னு ஒரு சர்ஜரி இருக்குது. கேட்ராக்ட் சர்ஜரி உங்களுக்கு தெரிஞ்சிருக்கும். அந்த கேட்ராக்ட் சர்ஜரியில் என்ன பண்ணுவாங்கன்னா they are going to replace the natural lens with an artificial lens. ஓகே, ஸோ அந்த மாதிரி இடத்துல கேப்சியூல் ரீட்டைன் பண்ணுறதுல ஒரு அர்த்தம் இருக்குது. ஸோ அந்த மாதிரி இருக்கிறதுல கேப்சியூல் ரீட்டைன் பண்ணுவாங்க. பட் ஹியர் there is no point in retaining the capsule. So I don't think they will try to retain the capsule. அதனால I'm not sure. I'm really not sure, but this is my opinion. Shall we continue? கொஞ்சம் எஸ் போடுறீங்களா? Shall we continue or you have to ask any more doubts? Now coming to the isthmus. Isthmusல these are rare relations, but okay, you have to have an idea about this. Isthmus is usually related to the tracheal rings 2 and 2, 3 and 4. இதை நம்ம ஏற்கனவே சொல்லிட்டோம். இந்த isthmusல இருந்து sometimes there might be a secondary lobe, accessory thyroid or pyramidal lobe. இதுக்கு வந்து இந்த மாதிரி ஒரு பேர் உண்டு, pyramidal lobe. So this pyramidal lobe might be if it is present, it is always connected to the hyoid bone through a connective tissue band. Okay, so that, and it might contain, the connective tissue band might contain a muscle called as levator glandulae thyroideae muscle. So this band might have a muscle. So this pyramidal lobe can be present. It is not abnormal. It is an எப்படி சொல்றது, it is quite normal, but it is present only in 40%. So that is not considered as the normal or normal anatomy, but this is accessory normal. So in the presence of this tissue, you should know this is the pyramidal lobe which goes from the isthmus. And isthmusல ரிலேஷன்ஸ், இப்போ மிச்ச ஸ்ட்ரக்சர்ஸ்க்கு நம்ம ரிலேஷன்ஸ் சொன்னோம், அதே மாதிரி isthmusக்கு ரிலேஷன்ஸ் இந்த pyramidal lobes நம்ம சொல்லிட்டோம். அதை தவிர upper border of the isthmusல the branches of the superior thyroid artery anastomose, upper borderல the branches of the superior thyroid artery anastomose, and inferior borderல the branches of the inferior thyroid artery anastomose. One more, when it comes to blood supply of the artery, sorry, blood supply of thyroid gland, there can be one more artery. Okay, apart from this, obviously இப்போ வரைக்கும் நான் சொன்னதுலேயே உங்களுக்கு புரிஞ்சிருக்கும், the blood supply is going to be superior thyroid artery and inferior thyroid artery. Superior thyroid artery is a branch of the external carotid artery. Inferior thyroid artery is a branch of the subclavian artery. So even if arch of aorta has a abnormal the blood flow is compromised, there is a connection between the carotid system and the subclavian system here. So there is an anastomosis between these two systems, maintaining the blood supply to the thyroid gland. So apart from that, there is an arteria thyroidea ema. Okay, arteria thyroidea ema, a direct branch of the arch of aorta, which might be present on the lower border of the isthmus of the thyroid gland. This is an anatomical this should be remembered because of the surgical importance. When the thyroid is approached for removal, this artery also needs to be ligated. So everybody should remember this also. Okay, so that is the relations of the isthmus of the thyroid gland. Okay, now coming to arterial supply, more than enough has been said. Superior thyroid artery, inferior thyroid artery, and arteria thyroidea ema. Okay, ipo Solomon, for your question, I'm answering it again. Superior thyroid artery travels with external laryngeal nerve throughout its course, whereas inferior thyroid artery and recurrent laryngeal nerve meets at the apex of the base of the thyroid gland. So this is the apex, in the base அதை நம்ம establish பண்ணிட்டோம். So apex கிட்ட superior thyroid artery and vein, superior thyroid artery and external laryngeal nerve தனித்தனியா போயிடும். பேஸ்ல தான் inferior thyroid arteryயும் recurrent laryngeal nerveம் மீட் பண்ணும். So superior thyroid artery இங்க பிரிஞ்சு போயிடுங்கிறனால ஏபெக்ஸ்க்கு கிட்ட வந்து superior thyroid artery லைகேட் பண்ணணும். inferior thyroid artery base கிட்ட தான் மீட்டே பண்ண போதுங்கிறனால inferior thyroid artery should be ligated as far as possible to prevent damage for the recurrent laryngeal nerve. Solomon, are you okay with that? Solomon? Please answer. Okay, sure. So again, blood supply is very important. Fine. Okay. Now coming to the venous drainage. Venous drainage, unlike artery, there are three sets of veins. There is a superior thyroid vein, middle thyroid vein, and an inferior thyroid vein. Superior thyroid vein and middle thyroid vein drains into the internal jugular vein, whereas the inferior thyroid vein drains into the subclavian vein. So that is the venous drainage. Okay, please note the presence of the inferior thyroid vein here. We have an important surgical anatomy for that. Now coming to the lymphatic drainage, as any structure, thyroid gland is also prone for cancer. Thyroid cancer is not that very uncommon. When I say two negatives, it becomes a positive. But when I say not uncommon, It is common but not very frequent. That is the difference. So here we have the apex part of it draining into the pre-laryngeal nodes, and that goes to the superior cervical nodes. The inferior part of the gland drains into the pre-tracheal nodes, which go, and the paratracheal nodes. Both of them drain into the lower deep cervical nodes, and they fuse. Okay, if there is cancer here, they fuse. So that is an indicator of thyroid cancer. So lymphatic drainage of thyroid gland கண்டிப்பா தெரிஞ்சிருக்கணும். essay questionல திருப்பி திருப்பி கேட்பாங்க. Now coming to the applied anatomy, I have repeatedly told you the applied anatomy when and where, but this is one important uh, the applied anatomy for thyroid gland, tracheostomy. நம்ம ஐயோ அந்த படம் பாருங்க, மெர்சல். எனக்கு அந்த மெர்சலை கோட் பண்ணாமல் இருக்க முடியாது. ஐம் வெரி சாரி, பிகாஸ் தட் மூவி இம்பேக்டட் மீ அ லாட் நெகட்டிவ்லி. அதில் என்ன பண்ணுவாருன்னா, தலைவர் வந்து ஒரு இதை ட்ரக்கியாவை ஓப்பன் பண்ணுவார், ஸ்ட்ராவை உள்ளே வைப்பார், அந்த லேடி மூச்சு விடும், அப்புறம் ஸ்ட்ராவை வெளில எடுத்துருவார். ஓகே, ஸோ அது நம்ம வந்து ட்ரெக்கியாஸ்டமி இஸ் நாட் தட் ஈஸி. இட் இஸ் அ வெரி complicated elective procedure if possible, but tracheostomy has been done in the field in emergency situations as well. But when we do tracheostomy, we have to be very careful because we cannot let the patient drown in his own blood. Okay, we have to remember the position of isthmus related to trachea. That is, the second, third and the fourth tracheal rings are related to the isthmus. So if you need to open the trachea at only this level, we have to, as you can see here, separate the isthmus, protect the isthmus and separate it, so that the bleeding does not happen into the trachea, the patient does not drown in his own blood. If we try to avoid the isthmus and go beneath the level of the thyroid gland, there also we need to remember the arteria thyroidea ema and the inferior thyroid vein. The anastomosis of the inferior thyroid artery is happening at the lower border of the isthmus. So these three structures we need to remember with the relations of the isthmus. Okay, so that is regarding the tracheostomy. Thyroidectomy, I have said more than enough, but remember 3 points for thyroidectomy. The true capsule has to be removed along with the thyroid. The superior thyroid artery has to be ligated as close to the apex as possible, and the inferior thyroid artery has to be ligated as far as possible. Okay, maintaining the relations of the external branch of the laryngeal nerve and the recurrent laryngeal nerve. So these are the important applied anatomy of thyroid gland. The topics that are left out for you to read are the histology of thyroid gland, which has been dealt in detail earlier, and the development of thyroid gland that will come with the development of the head and neck. Okay, I have come to the end of my class. Any doubts? Yes, in case of goiter, it will compress the carotid sheet, but not as much as it compresses the pharynx and the esophagus. Because as you can, as you know that the எப்படி சொல்றது, the free space available is medial. Okay, so posteriorly and apex எல்லா இடத்துலையுமே it is covered. So medial surface தான் அது ஜாஸ்தி பண்ணும், அதனால dysphagia will be the first complaint. Okay, no ma'am, இங்க no ma'am தான் போடுறீங்களா, no ma'am? Okay, ma'am. ஆப்வியஸ்லி பிரமிடல் லோபையும் அந்த ப்ரீட்ரக்கியல் ஃபேஷியா கவர் பண்ணி தான் ஆகும். ஸோ அது வந்து ஸ்ப்ளிட் ஆகி கவர் பண்ணுமா இல்லையா எனக்கு தெரியல. ஐ கேன் லுக் இன் டு இட் அண்ட் லெட் யூ நோ. ஓகே ஸ்டூடெண்ட்ஸ், ஐ ஹாவ் அ ரெக்வெஸ்ட். இப்போ கடைசியாக நீங்கள் இருக்கிறவங்க எல்லாருமே I can see 112 participants. I want your name and your number. You're going to comment your name and your number. Kana cautious vein, I will let you know in a short while. நான் classroomல போடுறேன். Surgical anatomy of inferior thyroid vein, tracheostomy சொல்லியிருக்கேன். Inferior thyroid vein can be ligated as close to the gland because அந்த இடத்துல isthmusல வந்து we have to remember the anastomosis of the inferior thyroid artery, the arteria thyroidea ima and inferior thyroid vein. So அது எல்லாமே வந்து it is close to the inferior thyroid, close to the isthmus. Easy off ஆஃப் பண்ணுங்க. Okay, today's attendance will be till 11 a.m. ஸோ 11 a.m. குள்ளார யார் யார் நேம்ஸ் போடுறீங்களோ அவங்களுக்குலாம் இன்னைக்கு அட்டண்டன்ஸ் இருக்கும். 120 பார்ட்டிசிபென்ட்ஸ் வரைக்கும் வந்தீங்க. லாஸ்ட் 30 வரல. ஐ திங்க் தூங்கிட்டாங்கன்னு நினைக்கிறேன். ஸோ அந்த லாஸ்ட் 30 சுரேஷ் அண்ட் சக்தி, you will ask them to private message me in WhatsApp. Okay, because I need to know their reason. நான் 11 o'clock வரைக்கும் வர அட்டெண்டன்ஸை அக்செப்ட் பண்ணுவேன். அதுக்கப்புறம் இருக்கிற அட்டெண்டன்ஸ் நான் அக்செப்ட் பண்ண மாட்டேன். ஓகே, ஸோ as usual complete your assignment because that is the another document that I have, and see you soon. If you have any difficulties, we have a classroom, we have a WhatsApp group. Come tell us your difficulties, then only we'll be able to help you. தயவு செய்து அசைன்மெண்ட் எல்லாம் காப்பி அடிக்காதீங்க பிகாஸ் நீங்கள் படிக்கணுங்கிறதுக்காக தான் நாங்கள் போடுறோம். ஸோ do not copy your assignments. Thank you, students. I'm stop ending my stream here.